Okay, I believe we are live. Hi, everyone.
Hi, everyone.
I'm just gonna double check just in case, because
Okay.
technology. So let's see, I have my phone here. I'm gonna double check if this is working, and I'm gonna go into the group. And I see us. Wonderful.
Awesome.
Okay. So I'm so excited to have a special guest here today, with someone who I really enjoy watching everything that she does, and I'm a big fan of what you're doing for dietitians. So I'm gonna go ahead and let you introduce yourself, and then I'm gonna introduce myself. I'd like for you to go first.
Okay. Thank you. Well, thank you so much, Joyce, for having me here and to have the opportunity to speak to your group. And so I'm Shawna Melbourne. I'm a registered dietitian and a certified eating disorder specialist with the International Association for Eating Disorder Professionals. And I am here for all kinds of reasons, but I guess one of them is because I am also the owner and creator of EDforRDs, Eating Disorder Education for Registered Dietitians. And what that is all about is that I teach dietitians from all around the world about eating disorders. Because as we can all appreciate, being dietitians and therapists and whatever your healthcare provider background is that I can very much appreciate that we really were not taught hardly anything about eating disorders. And so it has really been my mission over the past 8 years to be able to provide eating disorder skills to dietitians and so that you can really change the way that you feel about eating disorders. So outside of being a dietitian, I'm also a mom of two little boys and two fabulous little dogs and a horse. And we mountain bike and we do all kinds of really fun things as a family. But yeah, so back to being here. This is a really nice opportunity. So thank you again, Joyce, for having me.
So exciting. We tend to wear so many hats and, juggling so many things, and yet we're making it work. So kudos to you.
Yeah.
Um, so for those of you who don't know me, my name is Joyce Faraj-Ardura. I host the Nutrition Counseling and Coaching Facebook community where you might be watching this, or maybe you're watching it on YouTube. I'm also the founder of the Nutrition Counseling Academy. So it was just natural that what Shawna does and what I do just complement each other so well that when I saw what she's offering, I said, let's bring you in here. Let's see how we can collaborate in ways to really help fellow dietitians with all those counseling skills that we know, like Shauna mentioned, they're not really taught very much in our training. And even if they are, it's very different when
Mhm.
you're actually seeing clients and you're like in the thick of it versus when you're learning the theory and you're trying to get a good grade, right? Um, so if anyone's here live, I'd love to go ahead and see where you're joining us from. And you can type it into the comments. And also, as we go along, if you have any questions, please go ahead and just post them below. And we'd love to be able to answer them if we get your questions. Otherwise, we're just gonna have a conversation, very informal. So I like to share that I also taught eating disorders when I was a tenure track professor, and what was included in the curriculum was very limited. We had, I think it was 2 weeks. It was one module, 2 weeks in medical nutrition therapy, and we could only like skim the surface of one particular eating disorder. And that was it.
Wow.
Because
Wow.
we don't have enough time. And then they have, sure, like a graduate level course. But if it's not required to become a dietitian, then many are not going to take it until they need that support. So I love to ask you what your journey was towards getting into this area of eating disorders and what that looked like.
Oh, yeah, I love that question because I think we come from all kinds of different backgrounds and reasons why we get into eating disorders. I mean, just to reflect what you just said, Joyce, it's so true. I mean, you have hands-on experience teaching dietitians about eating disorders, and the limited time that you had, you completely appreciate just it's really skimming the surface, if that. When it comes to teaching to get, I remember when I was a dietitian, this was like a long time ago, like 25 years ago, we only learned the DSM-5, just the diagnostic criteria. And obviously, that doesn't do anything in terms of teaching us exactly what it's like to support people living with this disorder. It's like learning, the definition of diabetes, and then going out there and expecting to be able to support somebody living with diabetes. I mean, it's just not going to be helpful. Not only not helpful for us, but definitely not helpful for the people that we see. So going back to your question, how did I get into this? Yeah, it was really interesting. When I first became a dietitian, I thought I wanted to work in women's health, like with pregnancy and support, parents to be. And that's not at all what I ended up doing. I had a very, very brief stint in the eating disorder clinic in my clinical rotation. And there was a lot of stigma that I felt from that, not only the patients in the hospital felt, but also from the healthcare providers that were on the team trying to support these people. There was a lot of stigma, and it really made me scared, not really wanting to do it, unsure what to say, and I felt very clammed up whenever I went into somebody's room to even talk to them. I really didn't know what to say. And that stuck with me. And then when I became a dietitian, I actually worked at a clinic for about 7 years. And I didn't really know it at the time, but I was seeing a lot of people living with eating disorders and disordered eating. It wasn't until years later that I reflect back and I think, oh my gosh, yes, that's all that I was seeing. And and then after I worked at that clinic for about 7 years, it was actually a weight management clinic. Like most dietitians, right? We end up working in weight management because that's kind of what was expected of us. There's a lot of pressure for us to see people for weight loss. Um, and then and then that just, after 7 years, I was ready for a move. So I moved into a role at Children's Hospital of Eastern Ontario. So I'm from Ontario, Canada, and our local children's hospital just ended up being, one of the world's leading eating disorder programs. So I worked there for several years. I worked in the inpatient and outpatient and day treatment unit. And it was fabulous. It was a massive learning curve, which I thought that was never going to end. And it was really stressful, I remember at the beginning, because not only I was starting a new job, but then I was really immersed in eating disorders. And so it was a really big, really, really big learning curve. And then I just fell in love with it. It was just something with working and the population that, of course, it was adolescents being in a children's hospital. And there were just lots and lots of things that I felt like I bloomed with. One of which was really finding a way to connect to these individuals that were really, really struggling. And I don't know if any dietitian out there felt the same way, feels the same way as I did, but I really felt like the dietitian wasn't like the most enjoyed person on the team. And yet I found a way to connect with these individuals, even though I was the face with food. And that was something that I really held on to. It was something that really filled my heart. And then I had my first baby, and then I didn't go back to a full-time job. It just wasn't within our family, our family goals. One of our family goals was so that I was only going to work full, part-time. And that was working in a hospital. It took almost an hour to drive to. It just wasn't within the cards of our family. So I stopped working there. And then when my son was about 11 months or so, um, one of the people that I worked with at the hospital, they called me up and said, "Hey, Shawna, do you want to come and do private practice with us?" And I said, "Yes, yes, I do." And I was actually playing around with a little bit of private practice in eating disorders before I was pregnant with my first son. And so, yeah, and then I just joined Anchor Psychological Services here in Ottawa. And I was there for like 10 years, and and it just morphed. Like it just followed a path that felt like this was the path that was meant to be. And then about all coming up to 8 years ago, I started ED for RDs. And it's just something that, yeah, it just felt like this is just my calling. And I just followed through with what I felt was something that I was just supposed to do. I was really interested in connecting, like that connection piece was really, really important to me. That building trust was something that was, I felt like it was not always easy to do. And I was always up for a challenge and figuring out ways to connect with people who had just lost trust with themselves, lost trust with the world, lost trust with food, lost trust in general. And it was just something that really called to my heart.
Yeah, it sounds like you found the perfect calling, and it's just so amazing. It's almost like a miracle when you find, that match between what you really desire and then a values-driven opportunity that just blends so well with what you want to do, even
Mhm.
though it wasn't necessarily in your plans. But
No.
then things just opened up, and then one thing led to the other. And it's amazing to find individuals who are doing what they love in such a way that is, reaching so many others as well.
Mhm. Yeah, yeah, it is. It really, with anything, I think there are days that are really, really challenging, of course, and there are days that I think, oh my gosh, maybe I should be doing something else. But obviously the thought never turns into anything actionable because it still remains, even though that I've been working in eating disorders for coming up to 20 years now, it is still my calling. It's still something that I know that this meshes so well with me at my core and my values and just how I want to show up with people.
So despite challenges, you're still finding those glitters in the work
Yeah.
that you
Yes. Yes.
do. Wonderful. Now, I know that many of the fears, like the big fear that dietitians have is we don't want to do any harm, right? When it comes
Yeah.
to eating
Hmm.
disorders, like, am I actually doing something that's going to help my client or my patient, or could I possibly be, opening up a box of Pandora with like trauma and things like that?
Hmm. Hmm.
So I'm curious if you have any particular challenge that is really like stuck in your memory and how you worked your way through that. Like what types of maybe resources did you use or how did you get out of that, that mindset that we get into when we're like in fear of like treading wrongly?
Yeah, I really I think a lot about this. When are we causing harm? When are we not? As though it's two separate categories. And I also think, okay, well, what does it actually mean to feel scared about causing harm? And number one, I think it's so normal. I think it also really represents how us as clinicians, we recognize how vulnerable this population is. And I take that as a really important quality that we have as healthcare providers, that not only do we recognize how vulnerable this population is, but also how much we need to show up with specialized skills. So I think of it as like a really good thing, as in, if we do feel that fear, then we can turn it into something quite positive about what it shows about ourselves. I think it also shows that we are deeply compassionate and that we want to help. And whether that's our saviorism speaking, or whether it's something that we actually see that, no, I know I could help this. I know that I could help this person. I know that I can help this situation because of the way that I can show up.
Mhm.
So recognizing that it can be a real clear sign of how deeply compassionate that you are as a human. Um, the re the what I will say about myself is that I don't think I've ever really truly lost that. I don't think I've ever truly lost that fear of causing harm. And I'm also really okay with that as well, because it keeps me very mindful of where this person, where my clients are at and the types of experiences that they are working through. And it keeps me alert to how they are showing me what they are able to do or have capacity to engage in terms of the changes, in terms of treatment or recovery and whatever that means, or the conversations that we might have in session. So I don't think I've ever lost that. It's not as it doesn't stop me in my tracks as much as it used to. So I can still mobilize myself and move forward. And one of the reasons why I know that or how I can do that is that I've set up some really great resources around myself to be able to continue to mobilize, continue to keep going with treatment or with the care plan. One of the resources is supervision. I think supervision is one of the best ways to continue to mobilize yourself and to continue to work through your fears. Um, you have another human that you can talk to about your cases, what comes up for us as clinicians, because we all come to being a dietitian, helping other people with our own set of worries and fears and anxiety or history, our own experiences. And it's really important to work through what comes up for us. Um, and through the years, doing this for like almost 20 years, I can really pinpoint the areas or the times in which I get really triggered, and sometimes I don't always recognize it. So having a really good supervisor on my team to be able to help me with that and remind me that, oh, wait, Shawna, it could actually be triggering this part of you. Oh, yeah, right. And so we're able to work through it. But also having a supervisor there that I can bounce ideas off of and brainstorm, because there isn't one way in which is going to help everybody. And so to bounce ideas off of and to, put our brains together and have a fresh perspective, a different set of eyes on the case to help me through that. Um, so supervision for sure. Having some really good training under my belt has really helped me to form obviously that really good foundation of skills so that I can always go back to those basics. Going back to those basics and reminding myself, oh, wait, yes, okay, so this is the basics. This is where um, this is kind of a framework in which we can rely on. So going back to that, the basic training is really, really critical. Now, when I trained as a dietitian in eating disorders, again, 20 years ago, we didn't have anything that was like training. There wasn't anything that was available. There wasn't any online courses. There weren't really any good solid books out there. There wasn't even getting supervision, just wasn't really a thing that long ago. So I had to rely on, more experienced dietitians, more experienced therapists to really build my skills. And that's something that I come back to often when I'm working with clients or when I'm supervising other dietitians is that those basics. Um, So I think also it's also being really gentle and patient, not only with ourselves, but also our clients too. Um, and asking our clients. I think that not that we want our clients to do the heavy lifting and do that heavy work by explaining how they want everything done, because not, a lot of our clients don't really know what they want or what they need. But inviting our clients into the treatment and being really mindful about their journey and their experiences and providing them with ample space to describe to us when they have the capacity to be able to describe to us what they need and what they want, and really listening to them. I think that is something that I'm a really big proponent of, and isn't always something that is taken into consideration with a lot of eating disorder treatment approaches, but really honing in on our client's experience can really help us unlock some of our fears.
Yeah, I love that. And I do want to comment a few things on everything that you
Yeah.
said, because it's so important to realize that even someone like you who has a lot of experience and you're supervising others, you still get that supervision yourself, as do I. So I rely very heavily on supervision as well, especially when you have some challenging cases, and like reminds you of, okay, I need some support here. So then
Yes,
where can I get that support? And having that support network is going to be really important.
absolutely.
And how you mentioned that there weren't that many trainings out there. So we had to rely on others who had the experience. I remember 10 years ago when I was looking for eating disorder training, I found one. And the one that I found, I took it because that's all that was out there.
Right. Yeah.
Um, but yeah, it's you need to know where to find reliable sources as well.
Mhm.
Because sometimes when we have so many trainings out there, um, that might be targeting dietitians, it's really important to know like what are the reliable sources or the evidence-based ones. Where can we really find the information that we need coming from someone that has the experience to back it up as well?
Mhm. Mhm. And
Uh,
finding sorry, I
no,
think I
go
keep
ahead.
interrupting you. But I think also finding somebody that you want to train with, whether it's a course or supervisor, somebody that you admire, somebody that you really mesh well with, and somebody who will be your cheerleader, because this is really hard work, and we need somebody there to really cheerlead us on at times, and somebody who you look at and you think, oh my gosh, yes, I really like their approach or what they have to say, or perhaps their counseling skills, somebody who perhaps you wouldn't mind emulating your counseling skills after. So I think that that's really important because you're right, there are a lot more, thank goodness that there are a lot more training opportunities out there, online courses, etc. And so, yeah, I thought I'd throw that in terms of, how do we choose? How do we pick and choose which ones are going to be the right ones for us?
Yeah, and there's going to be more coming out,
Hmm. Hmm.
especially as people start to realize that this is a need. And I love how you said that we need to be able to connect with that person. And if we like what they have to say, then if we find that person uh, to be someone that we want to, learn from, then we're going to mesh with them. And that's another good way. Because I do believe that when it comes to, eating disorder counseling skills, it's about forming a relationship with those who are supervising you as well. It's meant to be more close proximity, I believe, than just taking a course that's going to be fully self-paced because we need that connection. We need that, back and forth. Um, and it's amazing how you've been able to create that. Now, you mentioned at the very end, um, helping clients discover, in a sense, what it is that they need because they might not know. So I'm curious if you have any, maybe a couple of questions that you have found to be really essential to have in someone's toolkit, maybe that can help you, not to give away someone's, like, I don't want to say power, but to help that collaborative spirit when you're with someone that can be so vulnerable and someone that needs that guidance and support, and they might not know what they need.
Yeah, 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 so true. Yeah, it's interesting because it isn't so much questions that I might ask, but really, I rely on normalizing,
Mm,
a lot of normalizing. So if somebody doesn't know what they want, sometimes I bring up examples like, in my experience, people just like you, sometimes they have said that they would like this or this or this. Do any of these options resonate with you? And um, by provide well, I mean that may not have been a great example of normalizing, but providing options and by saying something like, well, in my experience, a lot of people just like you may consider this or this or this. It also provides that message that we've heard it and we can handle it and we've got this and whatever you come up with is really safe with me. Um, and so using that kind of skill I find is very reassuring for the person that we're working with if they aren't sure. With normalizing, I might work at normalizing how they don't know. That it's really okay that they don't know, and that there's no expectation that they have to know what they want. Maybe we take a look at somebody in their lives that has the thing that we're talking about and what that might look like if they had that thing in their life, whatever that might be. Again, using like extrapolating that into somebody else that might be in their life, normalizing it as in, again, it's okay that you don't know what you might want, and here are all the reasons why it might not it's not coming to you the way that we hope it would. The other, a skill that I rely on heavily is actually we do bring in MI skills into the course that I teach, but one of the other skills that I also talk about is emotion coaching.
Mm.
It's part of a broader framework of EFFT, so emotion focused family therapy. And emotion coaching is a really beautiful way of addressing the emotion before we get to some of the fix it statements or some of the redirection statements. And I find through using a lot of emotion coaching that helps to break down some of the emotional barriers. And some dietitians that I work with, they're like, yeah, but is that outside of my scope of practice when we're addressing the emotion? And absolutely not. Just like MI, it's not outside of our scope of practice. And instead, it's really like our foundational skills that we need in order to connect with our clients. So yeah, so there isn't any specific question that I rely on, but more like my counseling skills, things like normalizing, things like MI, things like well, it might not be MI all the time, but emotion coaching, I use that a lot. Um, but I think one thing that I really rely on is building the trust. That therapeutic alliance is so critical. Um, and it's amazing how when people aren't sure about what they need, how it can come out, how it can really bloom when there's that beautiful therapeutic alliance that has been built between dietitian and individual.
Yeah,
And those answers come with time, and it can come with that really good solid foundation of trust.
I couldn't agree with you more. How it's really at the base of all the work that we do, the foundation of building that connection with our clients.
It really is. Yeah. Yeah.
We have one question.
Sure.
Hi, Aitza. So the question is it safe to also discuss or mention your own experience with an eating disorder or disorder eating with a client, or do you feel that it is not appropriate? That is a great question.
I'm so glad that you asked that. When I first started as a dietitian, I was always told, don't share your personal experience. I don't subscribe to that any longer. I don't think that it is always applicable to everybody's situation. There are things that we can consider when we disclose our own personal journey to our clients. We want to think, okay, if we're disclosing our personal experience, how will it help my client?
Mhm.
How is this going to be a benefit to my client? And it really can be. It can be a beautiful bridge for forming that, like, oh my gosh, my dietitian really knows, right? So it can really help with forming that beautiful therapeutic alliance because now the person has trust that you really do know, right? Because you have that personal experience. So we always want to think about how is it going to be a benefit to my client? um on the as opposed to I really want to tell this my story to my client because I think it's going to help me build that trust with my client, where kind of we want to think of it about it as the other way around. How is it going to be a benefit to my client to build that trust with me? um a couple of other things that we want to think about is also our clients that I work with and clients that people that live with eating disorders, disordered eating, they're often the biggest feelers. Call them super feelers. These are individuals who feel the most. They are the ones that can walk in a room and really read how everybody is feeling, probably before the other individuals actually recognize how they feel. And so what I I think about is that I wouldn't ever want to put the burden on my client to think that perhaps I can't handle it or that I'm not recovered enough or that they need to now take care of me.
Mhm.
So these are some of the things that I would want to think about or kind of go through my brain before I would disclose whether or not I lived with an eating disorder or not. Um, so the other thing that we can always do is even ask our clients, what would it be like if I disclosed to you, if I lived with an eating disorder? Or what would it be like if I disclosed to you that I didn't live with an eating disorder, right? Presenting two different sides of the story and talking about how it would affect the individual before we actually go into disclosing our actual personal experience. Um, again, it's all individual and in terms of what your own comfort level is like as well, as a clinician disclosing that piece of information. And again, it can have some really beautiful pros. But there's lots to think about before we dive into those stories.
Right. I love that. I love that answer. And how it can all be so individualized. But just
Mhm.
having them think about each scenario and then ultimately choose is such a great way to go about it.
Mhm. Mhm. Yeah, because ultimately they're the most important person, right? I mean, I know that we know that, but to say it out loud that they are the most important person that is there in the session. So we want to make sure that what we're doing in the session is going to be the most therapeutic for them.
Absolutely. Thank you so much for that answer, Shawna.
Oh, you're
I'm
welcome.
not seeing any more questions, and we're getting close to, the 30-minute mark. So I was wondering, if anyone else has another question, please go ahead and drop it. Otherwise, I would love for you to share, what are some of those resources that might be out there. And I think people would really appreciate free resources as well as, what if they do want to get more of that high touch, supervision type of support? Then what's out there for those who are looking to gain their skills and confidence when working with eating disorders?
Lovely. Yeah, yes. So we have at ED4RDs, so that's ED, FORRDS, Eating Disorder Education for Registered Dietitians. So that's what it stands for. We have a lot of free resources. So one of our core pillars that we operate on at ED4RDs is one of our 6 core pillars is giving back, making sure that things are really accessible and affordable for dietitians. So you'll notice that we have a lot of free things on our website, and actually I'm doing a 6 free Q&A session series. We started in August and we're going all the way to December. So that's one thing and perhaps I can provide Joyce with the links and everything, if you wanted to share those. So yeah, so the 6 free learning session. They're free Q&As. You can pre-submit your questions there, and I come on once a month and I go through questions, and actually we talk about themes. So even if you register for it now, you'll still receive the videos or the recordings from August. So that's one thing that we have. We have a lot of guides and handouts and PDFs and resources on our website under ED4RDs /freebies. And I just put out a new one. So, should I see this client or not in the community? So, this is really based on uh, you're seeing somebody who is medically compromised or medically fragile. That's kind of a term that I use for somebody who isn't quite medically compromised, but somebody who you're really, really, really worried about. And should you continue to see this client, or should you even take on this client in the community or not? And some things to think about. We also have some questions to ask your client and some assessment skills, and we have all kinds of stuff there. I also have a podcast. I just got it up on Spotify for the very first time. I feel very proud of
Nice.
myself because for in these last year or so, it's just been you could access it on my website, but now we can get it on Spotify. Okay, so we have lots and lots of free stuff on our website. In terms of upgrading to something that you would like to have like a little bit more personal touch, so we do have our supervision program. So this is where 2 dietitians meet with me once a month, and it's like a membership. So we just get all the sessions in the calendar for a year, and we just see each other once a month for that really good deep supervision session. And it's a really great way of saving money on supervision because individual supervision can get a little pricey. So this is a really great way of helping with that. Right now, registration as of today, yay, September 23rd, registration has officially opened for our 1 year online training. So this is 1 year of diving into 8 pre-recorded modules, all about eating disorders. And then we also have weekly Q&As that you can pick and choose how many you want to join up for. So some people can only get to a couple during the year. Some people are there weekly, so they're not mandatory, but like I think it's probably one of the favorite parts of the program. And within this program, and then as you start to apply the skills, then I'm there for you every step of the way, so that you're not out there trying these skills on. They're like, I'm not really sure if this is the right approach or not. You can come to the Q&A sessions. You also have access to the private Facebook group, and you also have unlimited email access to me. So again, as you try on some of these skills, you have access to support for an entire year. So it's a pretty in-depth course. But I would say on average, most dietitians spend anywhere between, say, 2 and maybe 4 hours a month in the course. So it's still really doable. And we send lots of emails and lots of touch points throughout the year to help everybody to stay on track. So that is open right now for registration with our extra early bird rate of 575 Canadian.
Which is, I think I did the math earlier, like 430 maybe US dollars or so.
About that. Yeah,
That's
it's
an
about
amazing
yeah,
price for the amount of value that you get by being in that program.
yes,
I
yes.
just dropped the link for the
Okay,
freebies as well
okay,
as for the ED4RDs 1 year program, and I wrote in the coupon code. When is that good through?
okay. That is good till, oh boy, you would think that I have the dates on the top of my head, but I don't. So let me just get over to my calendar here, October 4th.
Okay.
And then the early bird rate will kick in on the 5th, and that will be 675 Canadian.
Okay. The same coupon?
It will be the same coupon.
Okay. Wonderful. Well,
Yes.
thank you so much, Shauna. I don't see
Thank
any more
you.
questions.
Okay.
I think people really got a lot out of everything you were saying, not just about your journey, but the resources that you tend to use to, grow your own skills and confidence at this point, as well as what's out there for dietitians who want to get started or want to just take it to the next level.
For sure.
I
Well,
did
if
want to,
anybody,
oh, sorry.
sorry, I was just going to say, if anybody does have any questions after this, feel free to email me or catch me on Instagram or Facebook group. Um, but yeah, or Joyce.
Yeah, definitely. I'm posting stories on Instagram and I'm tagging you so people know to go there as well. And I
Okay.
did want to just make this like parallel. When you mentioned there's always going to be maybe a little bit of doubt, like whether am I doing the right thing or not?
hmm
Or and I think it goes by human nature. A bit of that is parallel to that imposter feeling. Whenever
Sure.
we're just doing our craft, we still have imposter feelings. I recently went to a talk last week and the speaker was mentioning that she met Maya Angelou. When Maya Angelou, I think she had written like her sixth or seventh book by the time the speaker met her. And even someone like Dr. Angelou was saying, I wonder when they're gonna find out that I'm an imposter or something like that. I'm like,
Yeah.
wow, like even like,
Yes.
individuals that have
Yes.
so much like so much experience and they're like, top of the line of what they do, there's still going to be some
Yes.
type of imposter feelings. And I
For
think
sure.
to an extent that's also a good thing because it kind of keeps us on our toes.
It
You
does.
got to know what mindset to approach that with.
It does. It does. Yeah, absolutely. I mean, we're working with other humans and that we're not them. We can take our best guess and we can use all the experience that we have and rely on other clinicians to, build upon our helping toolbox. But excuse me. But because we're working with other humans, we're not going to have all the answers.
Yeah, absolutely. The brain is a beautiful mystery.
Yes.
Well, thank you so much. And I'm gonna also drop
Excuse me.
the information in case anyone wants to follow you on Instagram as well. I can drop that
Thank you.
below. And
Okay.
thank you all for joining.
Yes.
Oh, we have a
Thank
question
you.
here.
Oh,
Jessica, what is the name of your podcast? Jessica, I'm going to share the link for the podcast because I was just looking at it.
okay. Thank you. Yeah, it's ED for RDs Inspire.
I love it. I love the name. There it is. Wonderful. I look forward to hearing it too. I didn't know there was a podcast out, so now I'm going to check it out.
Yes. Yeah. Okay. Wonderful. Well, thank you so much, Joyce. This has been a real pleasure. And thank you to your audience for jumping in with some questions too. It was great to answer.
Absolutely. I loved having you here. So we'll be
Yeah.
in
Thank you.
touch. And thanks
Okay.
everyone who tuned in or who's watching the replay. If you need any details, maybe you missed the links, go ahead and send me an email or comment on the Facebook community and I'll send it right over.
Lovely.
Bye.
Okay. Bye for now.